And I love the drawing behind your head. Who did that?
My
I love you.
granddaughter. This used to be her bedroom.
Uh-huh.
And so I thought, and she came over to visit and painted me a bunch of these. And I thought, well, that would be a good place to put that in her old room. So,
You bet. And does she love her grandma?
oh, probably not as much as I love them, but I think so.
I just got my first granddaughter this month, so I'm very excited about that.
Oh, wow. It's awesome. It's awesome.
Yeah,
Yeah.
yeah,
I think you're
yeah,
older, and so it's a lot more simplified with the grandchildren, you know what I mean?
yeah,
Yeah.
yeah. It seems like the best.
Yeah. It's really awesome.
Well, so tell me about your back. What's going on? Tell me what I need to know to try to help you figure this out and get rid of this pain.
Thank you, because I feel like I'm a gerbil on a wheel, spinning, just going really fast and getting nowhere with my back. So I kind of think I've
Mm.
had problems forever. Like when you're in grade school, the nurse will bend you over and they run their thumbs down your spine. They told me I have
Yeah,
scoliosis, but I thought it was in my upper back. So forever I've kind of had, I thought it was kind of normal, just kind of off and on back pain. But I was at work. I've been a meat cutter for 26 years. And I just got done throwing a 4 pallet load, and a sister store had borrowed product and brought it back in a shopping cart. And so I leaned over the shopping cart, picked it up, and instantly felt pain in my low back. And it was immediately, and I dropped the box back in the cart, and it didn't go away. It made my eyes water. And so I ended up going home that day, and I went to the doctor the next day, and that's how this whole thing started. The pain it doesn't go away. It's always there. The degree of pain changes depending on what I do that day. So I'm on modified duty at work. I usually work 40 hours a week. And now I'm only working 4 hours. I can't lift more than 10 pounds. And I'm getting a little bit nervous that I'm not going to be able to go back to that, because I've done that for 26 years. And it's the only thing I know. And
yeah.
I just had I was going to retire at 65. I only had 3 years left. And I don't want to retire with a bad back. So I'm hoping somebody can do something for me. I've had physical therapy, 16 weeks of that. I've had 6 weeks of back massage. I've had an epidural. So I do have an appointment with a surgeon. I had to ask for a referral to get that, but I do have an appointment coming with that. So, making progress. I just feel like
Well,
I
you,
waste a lot of time. Um,
yeah, yeah.
yeah.
Can I ask you a few clarifying questions?
Oh,
Is that okay?
sure.
So, how long ago was the day where you injured your back at work?
That was back in October of last
October of 2022. So
year.
it's been now the better part of 8 months.
8 months. Yeah.
And you saw a pain management doctor for the epidural injections, is that
Yes.
correct?
Yes.
And did they do a medial branch block and
No.
talk to you? They did not do
No.
that.
So I see an occupational doctor. I think
I
he's a
see.
physicist, and he has to write all the referrals to this stuff. He had mentioned that at one time, but it kind
Yeah.
of got lost somewhere. He's never brought it back up. So
I see. I see. And the
yeah.
pain management doctor didn't bring that up?
No, they offered me another epidural,
Right. Right.
but I declined that because the first one, um, I watched on video, so I knew what I was walking into, right? But I didn't see on the videos what happened. My whole leg went into a spasm, my whole left leg. It
Oh,
just, and it's probably normal, but I could feel it from
no.
my left cheek all
That's
the way
not
down into
normal.
my foot. It was horrible. It hurt. And I was so scared because I was trying to lay still, and yeah. So I declined the second offer for that. I went, no, thank you. So anyway, that's kind of what
Right.
yeah.
Because you're
I'll
smart.
pass
So
on that.
no, honey, that's not normal at all. They were in the wrong place with the needle and they caused pain
Oh,
and you were afraid and you're a lady meat cutter. I'm thinking you probably don't scare very
I
easily.
really don't.
You do not. So you were darn right not to go back. I think it's
Okay.
time to find a new pain management doctor, but we'll go over that.
Okay.
Um, oh my gosh, what a fascinating story, because when you look at your images, it kind of is like going to the end of the book and getting all the answers. And it really does explain what's going on with you.
Okay.
So if it's okay with you, I think the next step is just to skip on to the images and let's talk about
Okay.
what they
Uh,
show.
Thank you. I appreciate that.
Okay. Well, the first thing I'm going to show you is not in your spine, and it's what is called an incidental finding. It's
Is that
something
the
which,
cyst?
yes, the cyst on your
I
kidney.
saw that. I was wondering. I thought it was a tumor, or is this some kind of a growth on my, is that on my kidney?
Yeah, this is your kidney on your right side, and it's normal. And this is a spinal bone, and this is your kidney on the left side. And there's a big old cyst in that kidney. And we see that all the time, and it's generally nothing to be afraid of. Cysts can occur in a kidney just like they can in a breast or in the
Right.
brain, or, they occur all over the body, and they're nothing to worry about except the 1 in 100 that is a tumor. And if they resect it, you're cured, and if they don't, you're dead. So the way you find out if you're dead or no problem is by having an ultrasound. It's
Okay.
a non-invasive trivial test, but that's not something your occupational doctor is going to set up for you.
Okay.
You have to go to your primary
Well,
care
that's
doctor
something
and
I
say,
can use my own insurance on. They won't let me use my own
yeah,
insurance on
no,
this thing. So,
yes. But that's something you would use your own insurance on, and there's a 99% chance that it's not going to be necessary,
right.
and you should do it anyway because the
Okay.
1% chance is a big one.
Okay.
Okay,
Okay.
so that's out of the way. Let's go on
Okay.
and look
I
at the
saw
rest.
because I looked at my MRI before I had sent it to you, and
Yeah.
I saw that on there. I was wondering what, it kind of looked like it was on my kidney, and I thought the only thing that could be is a cyst or something. But
Yeah.
yeah, sorry.
Well, I want to start with some compliments, if that's okay with you.
Okay.
Beautiful shape of your spine. You've got the exact right curve. And the discs are really not bad. A
Okay.
lot of this is inherited. I assume mom and dad didn't really have any back problems.
No.
Yeah. I mean, all these discs, they've got some wear and tear on them, but they're really basically normal for
Okay.
age, which means you have a normal shock absorber system in your
Okay.
spine. Now, what I do see though, as you go down below in the perpendicular views, I want to show you something here. So this is the view we were looking at before,
Uh-huh.
and this blue line here is a cut that goes horizontal. And that's the image that we see over here.
Okay.
Now, in this view, we're looking right here. See that dark line right there?
Uh-huh.
We're looking at a joint in the spine. That is called a facet joint,
Okay.
and that's a normal facet joint on the left side, and here is a normal facet joint on the right side.
Okay.
If we go up a level, we see here some high signal, that's swelling in the facet joint on the left side.
Okay.
And then if we go up a little bit higher still, we see here on both sides really significant swelling in both facet joints. And that's at your L5, 4, 3, 2. That's at your L2, 3.
Okay.
That
My,
looks like an injury to me. Nothing else. Nothing else is swollen like that. This is a very unusual level to have that kind of swelling. It looks like some kind of a twisting injury. It's very consistent with what happened to you at work.
okay.
Here's your scoliosis, by the way. We don't have a good image of it, but this is your spine right down the middle.
Yeah.
And these bones should continue to align like this, but
Yeah.
they don't. They curve over this way. So they've got a little bit of curve. That's what the nurse was telling you about in school, was this should be straight
Well,
up
I
and
thought it
down.
was in my upper back. I didn't think it
It
was.
is. It is. It's both. So
Oh,
scoliosis, every curve, because gravity comes straight down, every curve has to have an offsetting curve. So that nurse was right. You do have it up above, but it's called thoracolumbar scoliosis. You have it in both.
Okay. That explains a
And
lot.
that's probably, you did really well, though. You've been doing
Yeah.
really heavy manual type of
Yeah.
work for decades, and you've been fine.
Well, I'm pretty
So
strong upper
very
body.
strong,
Yeah. Yeah.
very strong.
Yeah. So
Yeah,
that's probably helped.
for sure, for sure.
Yeah.
So
Yeah.
this really looks like a facet-mediated injury.
Okay.
And basically, the next thing is to go over what works. And what's
Okay.
funny about you is you've had all the treatments that are known not to work, and the
Okay.
only treatment that is known to work is the one you didn't have.
Okay. And
So,
that's the block.
yeah, you ready to talk about that?
Yeah, sure.
Okay. Yeah, I mean, the classic treatment for joint mediated pain in the spine is medial branch block as a test. And then if that relieves the pain temporarily means for a few hours,
Okay.
then you go on and have radio frequency ablation. And that's a great treatment for what's wrong with you.
Okay.
I don't know why those doctors, I mean, that would have been the first thing. Looking at your MRI, I think you probably maybe need a different pain doctor, to be
Okay.
candid. I don't
Okay.
know if you could overrule me, but the fact that they kind of didn't do the one thing that works, and it sounds like they're not really on the ball, and your
Right.
occupational doctor is, I mean, it should have been the pain doctor should have been telling the occupational doctor we need to do this.
Right.
So I don't know, maybe go to the occupational doctor and ask for either a repeat with this pain doctor, or if it were me, I would go to somebody else. And
Oh,
that somebody else may suggest they try epidurals and again decline. I've
right.
had the epidurals. I want to
Yeah.
move right on to medial branch
Okay.
block radio frequency ablation.
Okay. Well, I think this neurosurgeon that I'm seeing, I think he has his own clinic where they have pain management and offer all this stuff in there.
Okay.
I
I would
wish I
not
was
go to the
really
neurosurgeon for, if it were me, there's nothing surgical about your back.
okay.
And I would maybe request that you see the pain management doctor in the neurosurgeon's practice first, because
Okay.
I don't see any laminectomy, microdiscectomy, or fusion as
Okay.
part of your
Okay.
future.
So why did they give me the epidural in the S15?
They do that a lot to start, just to try to calm things down,
Okay.
but you don't have radicular type pain, and you
Right.
don't have any findings, numbness or weakness.
I do
So,
though.
oh, you do? Where's the numbness and weakness?
In my left outside of my calf and my foot mostly. Um,
Hmm.
well, how I got the MRI was I woke up at 3 in the morning and my leg was so heavy I couldn't move it. And
Mm.
so I pulled it up and I sat on the side of my bed and it came right back. And so I went to work, waited for the doctor's office to open, and I called them and they sent me to the emergency. They told me to go to the emergency room and get an MRI. That's how I ended up getting the MRI, was because of that. And then that, when I was leaving there, that doctor told me that it wasn't an emergency, but that I needed surgery, that I had stenosis.
You have very mild stenosis. You do not need surgery for it.
Okay,
And
that's what
that
they
numbness
said.
and weakness went away, right? That whatever happened that night.
Yeah, yeah. And she
Yeah,
said
so
it's
that
gonna
wasn't
be
your that
fine
wasn't
because
your
it went
back.
away. But yeah,
Yeah. Yeah,
yeah,
that was probably your leg fell asleep, or who knows what. But
yeah,
I and thank God, the best things are the ones that
yeah,
go
yeah,
away and we just
yeah.
don't care what.
But my foot, so a year ago last October, so it would have been in 21, I stood up from my desk and the foot was numb and my ankle immediately rolled and I thought I broke it because I couldn't put any weight on it. So I went to the doctor and it was just badly sprained. So I didn't know if that had anything to do with this or not, but that was a year ago last October. So that would have been in 21.
And
And I
that
got
was on the left side or the right side?
the left side.
Yeah, I'm just looking at it again. You can see I want to make sure I'm not missing anything, but I really don't see um, anything that's concerning.
Okay.
You know, you should be able to get back to work.
Oh, thank you.
Yeah,
That's the best news I've heard throughout this whole thing.
yeah. I mean, obviously you've done really good hard work for a long time, and I think you should be able to get back to it. You have a little bit of a far lateral disc on the left at L5S1, but I really don't think that's your issue at
Okay.
this point. So
Okay.
I would try that medial branch block RFA and then go for, if you don't get relief on the medial branch block, then that would be a sign that it's we need to consider something else. But I think that's definitely the next
You're
step
so
for you.
awesome. You've made my whole day plus some.
You're welcome. You're welcome. Who
I
could
feel so relieved, just not knowing, yeah, I feel so much better. Thank you so much.
yeah, yeah.
Yeah,
Well, I'm excited for you, and you gotta let me know what happens.
I will. I will. So do you think I should cancel that appointment with the neurosurgeon? Okay. Okay.
I would go see the pain management doctor in the neurosurgeon's office if there is one,
Okay.
or tell your occupational therapist you need that RFA. But it really is nice to be in a single office. So
Yeah.
if that clinic has like combined multi-modality treatments, that's usually a really good sign of quality. So
Okay.
I wouldn't mind seeing you get in there at all.
Okay. Okay. Thank you. Thank you so much for your time again. You're
All right,
awesome.
well, let me know what happens, okay?
Okay. You take care.
You too. Have a good day.
You too. Bye-bye.
Bye.